I'm going to give you a framework that will serve you as the other speakers talk a little bit about multiple myeloma. So we're going to do this in 20 minutes, and we'll do the same thing this afternoon in CAR-T. This is a soup bone that you buy in the grocery store, magnified. The soup bone has two parts. There's a thick outer white hard shell, makes the bone strong. You can jump on it, you can't break it. And then in the center of that soup bone is the marrow that you use to flavor your soup. When you buy it, it's brown, but it's brown because it's been oxidized. When you get it fresh, in a freshly slaughtered animal, it's bright red. It's red because that's where all your blood is made. That is the garden in which all of the blood in your circulation is produced, in this garden. And when you look, this garden actually has seeds, plants, fruit, and that fruit is the circulating blood. And when you look at what the makeup of the garden is, because it's got multiple different crops, 60% of the garden is dedicated to making your white blood cells, the cells that fight off infection, the cells that are monitored if you're on treatment weekly to be sure they don't get too low from the treatment you're receiving. 20% are the production of red blood cells. Those are the packets that carry your hemoglobin, that carries oxygen to your tissues. So if you don't have it, you're anemic. And in fact, in myeloma, 70% of patients are anemic. So they have easy fatigability. They have a lot of difficulty climbing stairs, walking up the incline, exhaustion, progressive fatigue. 10%, that's given over to the production of blood clotting cells. So those are the three major crops in this garden. Of course, that only adds up to 90%. 10% of the garden is actually a whole half dozen boutique garden growth. Cells that you don't need to know the names of, but there are eosinophils and basophils and macrophages, which are completely irrelevant to our discussion today. But in a normal adult, 1% of this garden are cells called plasma cells. And under the microscope, you can see them scattered intermittently in that garden, constituting approximately 1%. And the way your body works, this 60, 20, 10, 10, and 1% plasma cells, from the time you're 1 till the time you're 101, that is tightly regulated. That does not change over time. But one of the characteristics of malignancy is that the cells become unstable. And when they do, they get a growth advantage. And so the metaphor that we're going to be using about this garden is the fact that these plasma cells transform and begin to grow in the garden in greater numbers. And it's just easier for me to think about that as weeds in this garden. And when these plasma cells, these 1% get over 10% by convention, it is agreed that constitutes multiple myeloma when the garden acreage is 10% covered with these weeds, the plasma cells. Now you have plasma cells normally, everybody has them. What are they doing there? Well, those plasma cells are producing antibody proteins, helpful antibody proteins. So if any of you have gone to your doctors and say, hey, can you check to see if I'm immune to COVID? They do an antibody test that shows that you've got your immunity against COVID. That antibody was produced by a plasma cell in a normal bone marrow that responded to exposure to COVID vaccine or COVID virus and produced these antibody proteins. So as these weeds begin to grow, and they are unstable, and that's why they have genetic abnormalities. If you had your bone marrow examination, they looked to see if there were gene abnormalities that help predict outcome. But it gives them this growth advantage, and they'll grow. And at the time of diagnosis, the average number of weeds in the garden, average, is 30%. That's typically what you see, but it can range from 2%, some patients don't have many weeds, all the way up to 100% of weeds in this garden. And of course, when you get too many weeds in the garden, one obvious manifestation is as these weeds grow, what they'll do is they'll start to choke off the regular garden plants and interfere with their function. So one very common consequence, as these weeds go 40, 50, 60% of that garden acreage, they'll start to reduce the production of red blood cells, and you'll start to develop problems with anemia. So as these weeds grow, they begin to interfere. They also will grow into the garden casing. And when they grow into the garden casing, they actually produce, by X-ray, holes in the bones. The bones get weakened because these weeds grow into the casing of the garden. And if you look at things like your spine, the vertebrae, that's your vertebrae. And like every bone in your body, inside there's bone marrow here. And as these weed clusters start to grow in that garden casing, it weakens the bone, because instead of being a very strong bone, like that soup bone you bought in a store, they start getting replaced by little clusters of myeloma cells. And myeloma cells, myeloma cells actually have the consistency of raw liver. They're very soft, very gelatinous. So the bone gets weakened. And since the vertebrae carry the upper weight of your spine, an extremely common presentation is one of those spinal vertebrae will collapse under the weight of all of the others. And those spinal fractures, oh, they hurt like hell. I mean, they come down and it's like any other broken bone. Lie perfectly still, everything's fine. But if you try to flex your spine or rotate your spine or get up off the toilet, it's exquisitely painful. And 70% of patients with multiple myeloma that's active present because of these bony fractures. Either most common are ribs, spine, but typically almost any bone can be affected. So the problem, of course, is you've got weeds in the garden, and what ends up happening is you get treated with weed killer. Weed killer usually is best given multiple different types of weed killer so you don't get weed resistance emerging. So you use a lot of different ones. And you know the names: Darzalex, Velcade, Revlimid, Pomalyst, cyclophosphamide, Cytoxan, and your favorite, dexamethasone, Decadron, the one that allows you to clean the kitchen at 4 a.m. and alienate your spouse. But you use these multiple different weed killers in order to shrink down the number of weeds in the garden. And so ultimately, when you're asking about how am I doing, it's really about how many weeds are left over in the garden. That's the key. If you were 40 or 30 or 20%, did it go down? And the most direct way of assessing the number of weeds in the garden would be to have a bone marrow done every month. Great idea. Fortunately, that's not required, because these weeds, these plasma cells, are antibody producing. They make the antibody proteins. And when they become malignant and they start to grow, they retain that ability. They still make antibody proteins. And that's characteristic. And so because they make the antibody proteins, we can measure those proteins and use that blood measurement as a surrogate for what's going on in the garden and how many weeds are in the garden. So what are the antibody proteins? They come as the following: G, A, kappa, lambda. These are numbers you need to know. These are fundamental numbers that are indirect measurements of what's actually going on in that garden, because the only source of these G, A, kappa, lambda, sometimes referred to as M spike, the only source are those weeds. And so what we as physicians infer is that if you're, for example, being observed because you have smoldering disease that doesn't require treatment, then the expectation is these numbers, G or A or kappa or lambda, which you need to know if you want control over your disease, will remain stable over time. If you're getting weed killer and the weeds are being destroyed, then the production of the protein should be going down and we should see a decline, sometimes into the normal range. And if things aren't going well and the weeds are growing over time or the weed killer has stopped working, we start to see that protein level going up. But the protein's not the problem. It's the weeds in the garden, but we're using the protein as a surrogate to tell us what's going on in the garden without having to subject you to repeated bone marrow examinations. And so the lingo, our G and A are heavy chains, not important, but we'd be measuring your immunoglobulin G or IgG level or immunoglobulin A or IgA level, and the immunoglobulin-free light chains, which are more important because they're more sensitive, and they come in only two flavors, kappa and lambda. Knowing your involved light chain is really important for those of you who are beyond myeloma 101 or at myeloma 301. I'm telling you now, do not look at your ratio. The ratio is not a good measure of disease activity. Look at the involved light chain. If you have kappa myeloma, look at kappa. If you look at lambda myeloma, look at lambda. All right. So for most people up to age 70 or 75, you get 4 months of weed killer designed to knock down the garden. There's another step that definitely results in real improvement. And what is done in that circumstance is that you take the garden with whatever weeds are left over and you poison it irreversibly. So you know when you really deal with your garden, you've got your garden sprayer, you buy your teaspoon of ortho weed begone, fill it up to a gallon, spray the garden, kill the weeds. And that is an effective technique, but what's done in the technique I'm about to discuss is we've got the garden sprayer, we've got the gallon, but instead of taking a teaspoon, we're going to take a cup of weed killer, put that in the sprayer, and what we plan to do is irreversibly and permanently poison the garden, just kill it. And when we do that, we poison the garden. If that's all we do, that will be a very bad outcome because you've got to have a garden to live. You've got to be making the white cells that fight infection and the red cells that carry oxygen to your tissues and the blood clotting cells. So that isn't actually what we do. What we do is we take a precaution, and before we poison the garden irreversibly, we go into your bloodstream and collect seeds. Special technique, you need to get shots for 5 days. And what those shots do is those kick seeds out from the garden inside the bone into your circulating blood. And once they're in your blood, they can actually be skimmed off the way we skim butter off milk. We can take the layer of seed cells out of your blood, return your blood, and then we can take those seeds and we can freeze those seeds. And then once they're frozen, they can stay frozen for 15, 20 years. They're still good. Typically, it's not what we do. We put them in the freezer, and once they're frozen for a day or two, then we come back and we poison that garden. We go to the freezer and we thaw the seeds, and then we replant the garden from scratch. So garden seeds we refer to as stem cells. And the act of taking these seeds out of the freezer and planting the garden from scratch, that's called transplantation. We're transplanting the seeds back into the original garden. And so stem cell transplantation, which is now coming up on year 45 since its inception, is probably the one treatment for multiple myeloma that's been published more than any other, probably over 10,000 articles on transplant that repeatedly demonstrate the value of the technique in deepening the response, because the ultimate outcome that we're looking for is we really would like to see these proteins go to non-measurable levels or zero, and we want to see the garden show no weeds at all. That's our goal. Not always achievable, but Nowadays, we're getting there in about 50 to 60% of patients. And as a consequence, when I started, and it would be really rather impressive to survive 3 years with the disease, now we've got reams of patients who are out 10 and 20, and in my practice, 25 years because of these successive advances in these techniques. I still have 4 minutes, Greg. So I mentioned that it really isn't about the protein. It's about the weeds, because it's the weeds that cause the anemia, and it's the weeds that cause the bone damage and the fractures that develop in the ribs and in the spine that are so painful. But like most physicians, I lied. And 15% of patients, the protein actually is the problem. Because sometimes the protein, usually this light chain protein, kappa or lambda, accumulates at very high levels in the blood. And as it filters the blood through the kidneys, it actually gels inside the kidney like jello and blocks the kidney and damages the kidney. So 15% of myeloma patients actually present because their kidneys are damaged. And that's not an issue of the garden or how many weeds there are. They have the misfortune to have a protein that forms gels in the kidney and can cause damage. 2/3 of those patients, that kidney damage is completely reversible with our highly effective treatments, but that leaves 5% of patients who, despite everything, have significant kidney impairment, which carries consequences as you move down the line. A couple things, it's not all about the weed killer only. There's important aspects of supportive care. There are medicines that are available that are used to help rebuild the bone and reduce the risk of future skeletal events, fractures, or spinal compression. And so there are medicines that are given under the skin every month or intravenously every month that actually help prevent bone remodeling, prevent the bone from being reabsorbed, and help strengthen the bones over time and reduces the risk of fracture. So that's a very important supportive care. There are also techniques that are actually used where even with effective therapy, individuals can still have significant amounts of pain, even when the myeloma is well treated, due to the residual pain of those fractured bones. And so besides losing 4 inches in height, which some people will do, they'll have chronic pain and stiffness because their paraspinal muscles have to do all the work that their spine used to do, but now isn't capable of doing because the alignment changes here. For patients with persistent pain, there's actually techniques where cement can be injected right into the vertebrae, and that cement process can actually help reduce the pain. I don't know how it does that because the vertebrae doesn't increase in size or normalize, but people get very significant pain relief. So it's important to keep in mind the ability to strengthen the bone by injecting cement and the supportive care with monthly treatment to help strengthen the bone, at least for the first year after treatment. That's 19 of my 20 minutes. I don't want to run over, but Greg, can I take a question or two from the audience in my last minute? No. Okay, that's no problem. I'll be back to do the same thing for CAR T in the afternoon.